The decision to work in healthcare is obviously fueled by desire to help people, but it comes at a high personal cost. So much so, the American Hospital Association estimates a shortage of up to 3.2 million healthcare workers by 2026.
This is due to things like an aging population, as well as people are starting to catch up on things that they may have put off during the pandemic. Speaking of the pandemic, the healthcare workers especially suffered from a lot of burnout during that time. And so several of them left the field altogether. And then finally, the education pipeline has not been able to keep pace with the demand for healthcare workers. This is largely due to not having enough faculty, limited access to clinical training sites, as well as just straight up funding for some of these programs.
The burnout is real. So Indeed conducted a survey to gauge the state of healthcare workers and uncover opportunities to improve it.
Some of the great news we found in this survey is that the vast majority of healthcare workers want to stay in healthcare. So over 80% saying that they wanted to stay in. That said, about 1 in 3 do experience at least one symptom of burnout. So they are looking for those opportunities to promote better work-life balance, easier access to mental health resources to combat that burnout, as well as things like flexible scheduling. That's why we created the Careers in Care Hub on Indeed, which creates kind of a platform or a pick list of a ton of different resources, tools, tips, tricks, videos, articles, and so forth to help provide resources to healthcare job seekers as they're looking for new opportunities.
It's also important that current and future healthcare workers recognize the signs of burnout and how to manage it, because lives literally hang in the balance.
If you're starting to feel like exhausted all the time, you feel like you're not providing the level of care that you want to provide, or you're just starting to get disconnected or kind of even apathetic sometimes about your position, those are all signs that you could be starting to feel burnt out. Communicate that to your supervisors or your coworkers. Our survey showed that there was a strong correlation between those relationships that you have at work and your ability to cope. And then starting to build in like really healthy practices around burnout. So set boundaries. Things like shift incentives come up and they sound so good, but are they worth the impact they could have on your mental health? Doing things that kind of fill your cup or prioritizing that self-care, while it sounds cliche, is super important.
The survey did reveal a disconnect with employers who underestimate workers' need for emotional support, appropriate staffing, and work-life balance, but they can help turn things around.
It's doing basic things like making sure that you have a positive and supportive and inclusive culture, making sure that your teams have easy access to impactful mental health resources to help combat things like burnout. And then finally is making sure that your teams are listened to, not just heard. And so having those opportunities with your teams, whether those check-ins, rounding, listening sessions, and then collecting that feedback that you have and making sure that your teams feel that feedback has been actioned on.
Get more information on the Careers in Care Hub at Indeed.com.